Indigenous populations around the world are far more likely to be infected by or die by COVID-19. Australia has been an inspiring exception. Indigenous Australians were 6 times less likely to contract COVID-19. So far, 0 deaths and just 148 cases of COVID-19 were reported for the 800,000 Indigenous people across the country. Well, some of this success comes from the Australian government working collaboratively with these communities. Bit of a mouthful there. Well, this remarkable success is due in part to my next guest, Patricia Turner. She's worked to raise awareness about the pandemic in Aboriginal communities and to reduce vaccine hesitation and misinformation. She joins us now from the Australian capital, Canberra. Good to have you with us.
Thank you very much. Lovely to be here.
So it seems to me very clear that when you look at data from countries like Canada, from Brazil, from here in the US, that Indigenous populations are dying from COVID-19 at a much higher rate than the general population. The exception is in Australia. What do you put that down to?
Well, we moved very early. So I had an organisation, which is the PEAK organisation, the National Aboriginal Community Controlled Health Organisation, and we represent 143 Aboriginal community controlled health services at the regional or local level, right throughout Australia, from remote communities to metropolitan areas in the cities and the country towns. So we're a very widely distributed network. Our oldest health service is Redfern, which turned 50 this year. So a lot of other health services set up soon after the Redfern service, and it's an initiative and it's an act of self-determination by Aboriginal and Torres Strait Islander people in Australia to have their own comprehensive primary healthcare services operated at the regional and local levels, giving them the comprehensive primary healthcare that they want. So our organisations are run by the boards that are elected by community members, Aboriginal and Torres Strait Islander peoples, and they employ the staff, the CEO, who then engages all the other staff. And we have a great depth of public health expertise within our staff right across the country. So we employ over 6,000 people across the country. More than half of those are Aboriginal and Torres Strait Islander people, so we also create a lot of jobs for our people in areas where they live. And like I said, over the last 50 years, we've gained a lot of knowledge, a lot of experience, and we're now a very important part of the health architecture in Australia. So from the get-go, as soon as I heard that we had an infected man arrive in Melbourne on the 25th of January last year from Wuhan, I started to call all of our member services around the country to speak to those who had experienced with the previous SARS pandemic, where I knew that we had a lot of our people hospitalised and quite a number of deaths. And while I didn't really understand all that would come with COVID-19, I understood it was serious enough and we needed to act fast. So we started to do that. We started to order PPE in January as soon as we knew that there was a pandemic. Even before the World Health Organization declared it. So we were having these conversations. We set up a national advisory committee in conjunction with the Commonwealth Government, co-chaired by my deputy in my organisation, NACCHO, and a senior official in the Commonwealth Department of Health.
Right.
That
so I'm wondering,
advisory committee.
I just want to ask you, Pat, that when you look at the overall health outcomes of Aboriginal Australians, they are worse in general than the general population. Life expectancy is 8 years less than the general population. But when it comes to COVID, they're 6 times less likely to contract it. What lessons can be...
It's more likely because of the comorbidities. So Aboriginal and Torres Strait Islander people have a lot of chronic illnesses. And so they would be 6 times more likely to contract it than other Australians. But to date, we've only had 153 people who have been affected and no deaths. And that we put that down to the actions that we took in partnership with governments throughout Australia, led by we set up this National Advisory Committee, and they met very regularly, weekly in fact, last year. And they're still meeting. It's been an ongoing process, and all of the information from our members is fed through that, and we then seek the government's cooperation to ensure that the needs that are expressed in those meetings are acted upon. But I also wrote to the National Cabinet in March last year and asked for the National Cabinet to agree to close Aboriginal communities, discrete Aboriginal communities throughout Australia, because we could not afford for COVID to get into those communities. Because of the appalling living conditions of Aboriginal and Torres Strait Islander people that we still endure, COVID would have spread like wildfire, and it still could.
Yeah, it still could, given that the vaccination rate there is still very, very low. Patricia Turner.